Strategic Healthcare Group is a unique group of individuals led by physicians, but including nurses, quality managers, pharmacists, perfusionists that have the experience and knowledge base to be able to efficiently and effectively gather information and implement sound blood management programs. Strategic blood management is a process that we've developed, again, based upon our years of experience to very quickly go in and evaluate blood utilization processes across the spectrum. And those include not just simply utilization of red cells, platelets, FFP, and cryoprecipitate, but oversight, risk management issues, nursing issues, blood bank issues, perfusion technologies, patient management systems, really, again, a very broad area of blood and blood-related issues to make sure that these are being used, again, appropriately within a hospital. Critically important for hospitals to first realize there's the opportunity for improvement so they're motivated to change. The second component of the strategic blood management process is that we take this information and develop a customized implementation plan for the hospitals based upon their unique needs and give them a workable roadmap for change and implementing, as I said, positive blood management programs. The final piece is the support and the facilitation of the process through web-based learning tools, which are useful not only for very large hospitals in disseminating information across all medical staff and nursing staff, but even for the smaller hospitals who may not have access to consultants, lecturers, and national programs as well.
The Indiana Blood Center, like all community blood programs, is responsible for providing hospitals with a continuous and safe supply of blood and blood components. And there are times when our blood center, any blood center throughout the United States, experiences shortages. And one of the most frustrating parts of all of this for us as administrators or as blood providers is that we don't always have an understanding that blood at the hospital level is used in the most appropriate manner. So for us, having a partner in the hospital to look at utilization to make sure that it's appropriate, to make sure that it is that blood supplies are used wisely and judiciously and in the most meaningful manner for the patient is a real plus for our program.
When we first started our initiative at St. Vincent Hospital in Indianapolis back in 2001, we really thought this was going to be a generational process. What we found is that the integration of this was very, very quick within our hospital. We saw within our first year almost a 15% reduction in blood utilization. We engaged the proper people, the thought leaders, the opinion leaders, the leadership positions. We used the right language, which again is appropriate blood utilization, not bloodless medicine. And I think we made a sustainable sort of a system. The end result of this process, which really was a very rapid integration into a large tertiary care hospital, is that we've reduced blood use by almost 35%, and we've done that for 7 years running. Our net savings, if we look at all the hospitals that we've worked with, exceed $45 million to date, and impressively, we're sort of just getting started.
Transfusion medicine has evolved amazingly, and we still have a lot of physicians out there practicing what they may have learned 20 or 30 years ago that were taught to them by their resident, and nowadays it really doesn't apply.
If you look at it purely from an administrative standpoint, the fact is if they're unnecessarily transfusing patients, they are unnecessarily utilizing tremendous amounts of healthcare dollars. And it's not just the purchase price of blood, which can be $200 or more per unit, but the associated nursing costs, laboratory costs, adverse events costs, which could easily quadruple or even 10 times those amount to the hospital at the end of the day.
Service fees are going to continue to climb. So I don't know that strategic blood management in and of itself will have a direct impact on blood service fees. Where it will have an impact, and a very definite impact, is on the overall cost of blood to a given hospital. Where we want to be at the end of the day is that all of the dollars expended for the community blood supply by an individual hospital is appropriate expenditure of hospital resources, and that it's used in a manner that is most appropriate for the patient so that you have very positive outcomes and you are able to control your costs through utilization.
The other piece I think that's critically important is the risk management standpoint. Blood is a very hazardous process in the best of hands. There are risks associated with misidentification, adverse events, and again, overutilization. So from a risk management standpoint, hospitals benefit from that as well.
There is always a connection between transfusion and risk management. So from just a pure risk standpoint, if you know that your transfusions or all of your transfusions are done in an appropriate manner, then you, right there in and of itself and by itself, you reduce your risk.
Strategic Healthcare Group, goes into the hospital. They look at the records. They look and see, okay, how are transfusions being done, and then they can start making the appropriate changes. And this really is such a vital link. I've been here 10 years now, and when I first got here, we went into a serious blood shortage, and people like Tim were the first to come up and say, wait a minute, it's not a question of what the overall supply is. It's a question of what are the hospitals doing with this. And over the years, it has really evolved that we have had rare shortages.
Through lower utilization, we've been able to increase our reserves or increase blood available for other hospitals.
The beauty of the program is you really start and you look across all service lines. You're not just going for one area like surgery. You're really going into wherever blood is used. And it really becomes a great partnership. It helps the blood center, it helps the hospitals you serve, and really the community.